you. It's very nice to see some familiar faces. I've been encouraging my clients to come this direction. So this is an opportunity for me that's actually really fun. I get to speak about something that I'm passionate about. I was just telling Dr. Daly that I have my dream job. Truly, every day I look forward to coming to work, and some people think that and I'm sure our physicians get this as well, just how can you do this kind of work? It's so depressing and people are struggling with health issues, and it truly grounds me and it helps me appreciate my life more, and it feels like it's real, and heck, we're all gonna be there one day, sooner or later, and we all hope it's just later. But my clients are an inspiration. And so I guess today I just wanna share with you, talk about the benefits of being present. So being here right now, you can hear the sound of my voice, you can feel your feet on the floor, you can feel the weight of your arms in your lap. You might even notice the sensation of breathing, how active your mind is, whether you're thinking about the past, the future, somewhere in between, kind of story that's running through your mind, how that makes you feel. And you're already somewhere else. And this is what I'm going to be talking about for the next half hour or so. And I've left a bit of time, hopefully, for some practice as well. So time is always my challenge. I tend to have more material than I can get through, so please let me know. I'm hoping to have 10 minutes at the end, if you can keep me on track. Thanks, Michelle. Just to start with the fact, acknowledging the stress of stem cell transplantation, and we all know, I don't need to tell you this, that receiving a stem cell transplant is not only physically demanding, it's also emotionally taxing. The mind tends to follow the body, and when our body's not feeling well, our mind tends to feel less well as well. But research supports the fact, shows us that there's a high prevalence of emotional distress, anxiety, and depression for individuals who receive a stem cell transplant. Distress levels tend to be highest pre-transplant and to decrease over time. There can be some research shows a surge, an increase in depression after transplant and then normalization. But elevated distress is identified in a significant majority of long-term survivors, so a year out, that a significant proportion of individuals would say they're still experiencing distress, anxiety, depression at quite a high level. And depression rates are significant as well. So within the first year post-transplant, 1 out of 3 patients would meet criteria for depression that would be moderate to severe in severity. Fortunately, many studies do show normalization, though, of emotional distress at about 2 or 3 years out post-transplant. And clinically, and research backs this up as well, that many people experience the profound emotional impact of adjusting to change as a result of the transplant and associated treatments and medication and all of that, and also grieving losses. And that change and those losses may be short-term and transient, or they may be long-term and chronic, and something that the individual is having to live with. And those might be changes in appearance, changes in roles, work life, relationships, sexual functioning, might be changes in friendships and self-image, maybe changes in cognition and mood. So the changes that one can experience, there is no end to the range of changes, and sometimes these changes can actually be quite positive as well. We've touched on post-traumatic stress. We know that there's also something that occurs called post-traumatic growth, and that's where people, after a life-threatening illness or a serious treatment, experience over time a heightened sense of what's most important to them. So a heightened feeling of connection, meaning, purpose, faith, spirituality. So I'll be referring to a few of these concepts a little bit later. And another thing I often share with my patients when I first meet with them is acknowledgement of the difficulty in coping with 2 things. One is uncertainty, so the not knowing. This really big, scary thing can happen to me. For example, my cancer could recur after transplant, and I don't know. I just don't know, and that drives the fear, the feeling of anxiety, the feeling of the other shoe. When is the other shoe going to drop? And also a profound sense of loss of control, so that your body will heal at its own natural rate and rhythm, and also during the more acute phases of transplant, that there is an extreme feelings of loss of control for many people. So just want to acknowledge, although you probably have your individual experiences, there is variability there, that BMT is a very stressful experience for most people. Similarly, that caregivers experience heightened levels of distress, and interestingly often, well, not in a good way, but interestingly often higher than the patients themselves, and that patient and partner distress often parallels each other. So if patients are more distressed, that their partners also tend to be more distressed, and vice versa, less distressed, less distressed. And so it follows that caregivers and survivors would likely benefit from stress management. I guarantee a few of you in the room have heard the word mindfulness before. I could take a show of hands. How many people? Yeah, a good proportion, at least half, I'd say. Because there's a real surge of interest, not only in medical health centers, mental health centers around the world, but also in the popular media around the use of mindfulness meditation to manage stress and improve quality of life. And so actually, a lot of what we see in the popular media, we'd have to go back to the late 1970s to realize how mindfulness came to the West. And back to the late 1970s when a gentleman named Kabat-Zinn, and he was a medical researcher in the US, developed a program called mindfulness-based stress reduction. And this is an 8-week group intervention that consists of mindfulness meditation and gentle yoga. And he developed this program for people who he perceived as falling through the cracks of the medical system. So people who struggled with chronic pain, autoimmune conditions, chronic illness of some sort, and didn't feel they were able to manage their symptoms, this program was developed. And since its development, it's actually been implemented widely across the world. There are hundreds of these programs, these meditation programs offered in medical centers and mental health programs, and they're combined with different types of psychotherapy and have a lot of empirical support now. And our program was developed here at the Tom Baker in 1996, so it's been just over 20 years that we've been running our meditation program. Dr. Linda Carlson and Michael Specka are two psychologists in our department who tailored John Kabat-Zinn's program for cancer care, and the program's offered for patients and family members or caregivers, and it's called Mindfulness-Based Cancer Recovery. So you may, if you're around the Tom Baker or the Holy Cross sites, see our brochures. This number's old, so I'm sure there are plenty more now, number of patients who have participated, but it's quite a significant number. And there's an ongoing program of research. So I will touch on some of the research today as well, just to give you a taste of it. But I want to talk first a little bit about what mindfulness is. And I introduced it briefly when I started to talk today. But mindfulness is the overarching theme of the MBSR program. And it really, in a nutshell, is moment-to-moment, non-judgmental awareness. So paying attention to what is present right now without judging what we're noticing as being good or bad, right or wrong. It just is what it is. And heck, it's already there. So it's witnessing it, observing it, and rolling out the red carpet for our experience, good or bad. It's already here. Observing what is here. And a natural outcome often is relaxation of focusing on the present moment, but it isn't the intention. The only intention is truly to be present in a way that is kind to ourselves in what we're noticing. We teach a lot of different, I don't actually teach the program currently, but I have in the past, but teaching the various techniques to be able to generate mindfulness, the quality of mindfulness. So one of the practices is to focus on the sensations of breathing, and you might focus on other sensations in the body while seated, walking, or lying down. So that's called the formal meditation practice. It's what you imagine when someone's sitting on a cushion with their legs crossed, although many of our participants don't. They sit in a chair and get just as much benefit, I'm sure. And also there's what we call informal practice of mindfulness meditation or mindfulness. And that's just really acknowledging that any moment can be can be experienced mindfully. So right now I could be present, or I could be thinking about what I'm about to say, or beating myself up for the thing I said incorrectly a minute ago. When we're brushing our teeth, we might be how often do we slow down and actually notice what the toothpaste tastes like, and actually the rhythm of the circular motion? Wait, I'm going like this, and my dentist said to go. So we can, if we actually slow down, it reduces the automaticity of our lives, and we actually are fully showing up and paying attention. And brushing our teeth tends to take a little longer, but sometimes it's worth it. So generally, we notice when we're being mindful is that what we notice is that we're functioning a lot of the time on automatic pilot. And how many times have we gotten into the car, driven from A to B, and not even realized how we got there? So how might that experience look different if I was practicing being there and actually feeling the sensations of my hands on the steering wheel, and taking in the atmosphere around me, hearing the music, actually hearing the music on the radio? It's a different experience, and often one that is more rich. Also, I wanted to mention about automatic pilot that there are direct applications for stress management, because when we are tuned out rather than tuned in, we miss a lot of the signals our body tells us. And often we're zoned out or tuned out or unaware of those habitual reactions that we might have to our environment or to our own thoughts and feelings, the way that our own actions affect our body. And so we aren't aware a lot of the time when those habits, those automatic reactions aren't serving us. They're actually serving something else that is less healthy for us. So practicing mindfulness, the first step is just noticing and becoming aware of those patterns. Then we can be in a position to start to make healthier choices, to respond rather than to react automatically. I really like this cartoon. The cow says, "Hey, wait a minute, this is grass. We've been eating grass." So it just goes to show that the cows have been eating grass their whole life, but what is it that we're doing every day of our lives that we don't even realize that we are? Just briefly to mention a few other components of the MBSR program. Gentle yoga is included in the program, and it's really a moving meditation. Yoga can be practiced as a real physical exercise in a hot room, for example, or it can be practiced as a moving meditation where it's very gentle stretching and using the sensations in the body with the movement as a focus for our attention. Really, often for people who have undergone a serious health treatment like transplant, it is about reconnecting with the body and developing that sense of body awareness again and relationship to one's body, and feeling like you can start to trust it again, because that's also one of the significant losses people share is I don't have a sense of it that I can trust my body anymore. So that yoga piece actually is a really important part of our program, and can be practiced even if you're not feeling well because of pain or limited mobility. You can sit in a chair and just do what you can, and the instructors help you adjust. Other components include relaxation, so we do teach some deep breathing and some education around stress, and you learn a bit about your own unique stress response and how the body responds to stress. We teach some visualization and imagery, cognitive coping strategies, and we also believe that all of the components engender a sense of personal empowerment, that a sense of agency and mastery, that I am doing something for myself. When I feel like I can't do anything, this is something I can do to help myself. And also that social support naturally emerges, even though it's not a support program, but it is a group of people coming together to practice and learn some new tools. So naturally there's some cohesion there that happens. Just to mention, this is just some images from our program that are quite old, but it just gives you a sense for the feel of the group. And I'll touch on some research now. So I'll start with the original randomized control trial that Carlson and Specka conducted, was published back in 2000. And I like this one just because I have some really nice graphs to show some of the effects of the program. But basically that a group of patients who had had a cancer diagnosis at some point in the past, a mixed group, so it didn't have to be one type of cancer, and that some were on treatment, some were off treatment. They were randomly assigned to either participate in the program, the meditation program, or to naturally wait on a wait list and wait till the next program will start. And we just measure these things using questionnaires, mood and stress symptoms and other things. And what we observe is significant reduction. So the blue line is the meditation group, and you can see that there are significantly more reduction in anxiety, depression, anger, fatigue, and confusion in the MBSR group, increased vigor in the MBSR group. And so that's in terms of our mood measure there. And in terms of stress symptoms, you can see greater decrease in habitual patterns like nail biting, smoking, decreased muscle tension, cardiovascular stress symptoms, so things like racing heart and sweaty palms, irritability and anxiety also reducing significantly more than in the naturally waiting control group. And these effects of the program were shown to be maintained at 3 and 6 month follow-ups as well. So that's just a peek at some of the early research, but the research has been ongoing over the years, and there's some really interesting research being done that includes physiological outcomes. I looked at blood pressure for my master's degree, and Dr. Carlson is doing some really neat studies with telomere length. I don't know if you know much about that, but some biomedical outcomes, and doing some work across Canada with Toronto and comparing to active control groups. So those for all the research geeks in the room, sorry. But just to mention that overall, the research now, that's the published research of MBSR with cancer patients, includes reduced symptoms of anxiety and depression, reduced perceived stress, improved sleep and fatigue. So we did a sleep study that participants who took the program relative to a waitlist control showed a 1 hour of sleep on average increase, 1 hour a night by the end of the program relative to the beginning. So that was quite powerful, and we also had a measure of quality of sleep that improved as well. Enhanced spirituality and meaningfulness, so those positive outcomes I referred to earlier, and increased mindfulness. We do measure mindfulness with questionnaires, again, trying to understand, are people actually becoming more mindful? Reduced rumination, because a lot of the time we're worrying about ruminating about the past, worrying about the future, and that reduces through the program, as well as fear of recurrence. And many of these benefits are maintained after the program ends. I'm always looking for studies that are done looking at mindfulness in BMT survivors, and there is a pilot study that was conducted years ago for during that really acute hospital phase, and with a small sample, but there's recently been a study published by Grossman and colleagues. It was a randomized control trial of mindfulness training versus an active control group, so comparing the mindfulness group with a group of people who were receiving psychosocial phone conversations with a counselor a couple of times a month for half an hour. And participants in this study had to be at least 6 months out from their transplant, so they were considered outside of that acute recovery stage. And dropout rates were quite modest. They stayed in the program. Results showed a moderate to large effect in terms of improved quality of life, reduced depression, and reduced anxiety. Benefits for caregivers, I have yet to see a study for caregivers of transplant patients, but that the caregiver literature is significant in terms of mindfulness, in terms of the general caregiver literature, and it focuses more on other types of caregiving, like caregiving for children with developmental disabilities and chronic conditions, or a family member with dementia. So what we see generally parallels what we've seen with patient groups, which is decreased stress symptoms and mood disturbance, and increased mindfulness, self-compassion, and well-being. Our group actually conducted the first study of cancer patients and their partners, and showed that the decrease observed for patients in terms of stress symptoms overall, which is the blue line there, you can see is the patient group, was paralleled by decreases in stress in their partner. So that's quite interesting just to see that occur as well. And that increases in spirituality occurred as well for both the patients and their partners. Now that we know mindfulness is helpful, the question has moved now not just to looking at does it help, to how does it help, and for whom does it who benefits the most from the program, because it is about fit, like any intervention, and what kind of individual would be best served by this program. Do some people improve more than others in terms of mood and that kind of thing? So again, this was the focus of my PhD research, and I will not go into the details, but just to mention that we're looking at do some of the things you'd think would change through the program, like decreased rumination, decreased fear of recurrence. Are some of these the reasons why people have less depression 3 months down the road? Switching gears and taking a sip of water, I'm going to talk about compassion. Because compassion is seen as the essential capacity to develop in conjunction with mindfulness. So they're like two wings of a bird. And all of us have, just like mindfulness, we all have the capacity to be mindful, and we all access that capacity to some degree or other, some more, some less, just naturally. Same thing with compassion, that we're all born with an innate capacity to be compassionate and to access that quality, we can develop the capacity to access our compassion through mindfulness and meditation training as well. So compassion is defined, you probably all have a definition in mind as to what compassion looks like, but it is the wish to alleviate suffering in another. So it's the wish for the other to be well, to be free from suffering, to be free from pain. And I like Thomas Merton's description as well, that the whole idea of compassion is based on a keen awareness of the interdependence of all living beings, which are all part of one another and all involved in one another. It speaks to the fact that compassion includes being aware of our pain or the pain of another, because you can have self-compassion, right, or compassion towards somebody else. Being aware of that pain, acknowledging that it is a human condition, that we all suffer, and we all wish to be well, and then holding that pain with kindness and with gentleness. And so is there a benefit to developing this quality, this capacity that we all have? And the answer is yes. But that mindfulness can be thought of also as compassionate awareness. And isn't it true that it's the easiest, least painful way to hold our own inner experience is to hold that experience with kindness? So you've probably also heard of compassion fatigue, and you hear a lot about compassion fatigue in caregiving circles, both in professionally and also for caregivers of people who need care. And there's a lot of research showing a difference between compassion and empathy, and actually finding that empathy is that sense of, I know how you feel, I'm feeling what you're feeling, and feeling that in a way that's lacking buffer or protection. So it tends to be when you're feeling what someone's feeling without a buffer or protection, you're at risk for being overwhelmed by that feeling, or even starting to emotionally detach from it, or even burn out. So whereas compassion, the research is telling us, is protective and buffering in the caring for somebody else, in that when you wish someone well, when you access that part of you that wants them to be well, that it actually is protective. And so you can feel what that person is feeling while holding your wish for them to be well. And this actually can prevent burnout, is what the theory is. The compassion research in general supports associations, so not causal relationships at this point, but associations between having someone who has higher levels of compassion, has lower levels of inflammation, and possibly also longer life. And that self-compassion is associated with having lower depression, anxiety, and perceived stress, and is also shown to be associated with less emotional impact of pain, illness, and the aging process. So again, supporting that theory that it is protective and buffering. So I'll share with you a quote by His Holiness the Dalai Lama. "Love and compassion are necessities, not luxuries, and without them, humanity cannot survive." So I will now take you into a bit of practice. So I have a bright light shining in my face, but I think you guys should be okay. So taking a moment to just get comfortable in your seats. I'm going to, please feel free not to participate if you don't want to, but if you do, join me. And finding a comfortable position where your spine feels upright and your belly can feel relaxed, your head resting on your shoulders. So just making whatever adjustments you might need to make in order to feel stable and secure. And I'm using the bells just to signal the beginning and end of our brief practice today. So as the bell fades away, allowing your eyes to close if that feels comfortable for you, or gazing in front of you with eyes slightly open, gazing toward the floor. And bringing attention inside your body, becoming aware of the fact that you are breathing. So tuning into the sensations of your breath, wherever you find them. If you'd like, you can take a couple of deeper breaths just to make the sensations a little stronger. You might feel the breathing strongest at the belly, chest, or nostrils. The entire breathing process. Just choosing a spot to focus on for the next few minutes of practice. Releasing any need to control the breath, just letting it flow naturally in and out of the body. Tracking the breath with your attention. Observing the breath as it rises and falls. Chest and belly expanding, contracting. You may feel warmth or coolness. Back of the throat. Breath may feel thick or thin. Resisting the tendency to judge, just letting any judgment go. Any desire to have the breath be different. Just this one breath. And of course, you'll notice the mind has wandered away from time to time, as minds do. Some thought or image, memory, just letting that thought go. The moment that you have noticed the mind is elsewhere, it's the moment you know that you're doing this very right. Coming back again to the breath, congratulating yourself. And being gentle with yourself as you practice observing the in-breath, the out-breath, and the space in between. Nowhere else to go. Just being right here. Allowing yourself to be exactly where you are. Coming back again and again to the sensations of breathing. And slowly, when you're ready, you can open your eyes and come back to the room. Does anyone want to share what they noticed? Yes.
We'll need it.
Yes. Does anyone have questions for me before we wrap up? I didn't bring any of our brochures for the MBSR program or MBCR, but you can find them in the outpatient areas at the Tom Baker, Holy Cross, and my contact information as well is on here. Oh, I'll share a poem with you. Why not? How about this one? The summer day. Who made the world? Who made the swan and the black bear? Who made the grasshopper? This grasshopper, I mean. The one who has flung herself out on the grass. The one who is eating sugar out of my hand. Who is moving her jaws back and forth instead of up and down. Who is gazing around with her enormous and complicated eyes. Now she lifts her pale forearms and thoroughly washes her face. Now she snaps her wings open and floats away. I don't know exactly what a prayer is. I do know how to pay attention, how to fall down into the grass, how to kneel down in the grass, how to be idle and blessed, how to stroll through the fields, which is what I've been doing all day. Tell me, what else should I have done? Doesn't everything die at last and too soon? Tell me, what is it you plan to do with your one wild and precious life? These are the 2 books that we recommend with our meditation program, and there are lots of reading out there. I'm happy to send you reading lists and resources if you'd like. You can come by and leave me your email address, or you can follow up with me. So here's my contact information. If you have any questions, thank you.